A common problem with proximal hamstring tendinopathy is pain with sitting. So in this video, we'll go over the anatomy to discuss why the proximal hamstring tendon tends to get irritated with sitting, and then also a couple of exercises that we can do to help decrease the pain with sitting. So when we look at the anatomy, the red band here is going to represent our hamstring muscle, and we can see that it attaches onto this ischial tuberosity here. And so when we sit with our leg flexed to about 90 degrees or so, and that's going to add a little bit of tension onto this hamstring and add a little bit of compressive load between the tendon and that ischial tuberosity. And then when we're sitting on something, that's generally going to be on that ischial tuberosity as well, further increasing the compressive load. And so that's the reason why we think that proximal hamstring tendons generally are irritated with sitting, is that they're not able to tolerate that compressive load. And so from a treatment aspect, there's two routes that we can take. The first one is obviously sitting on something a little bit more soft to decrease the compressive load that we're putting on the tendon. So sitting on a cushion or a couch or something like that, as opposed to sitting on a stool or a wood bench or something like that, which is just going to be adding a little bit more compression. And from a rehab treatment aspect, what we want to do is increase the tendon's tolerance to loading. So we're actually going to load it into a little bit of that flexed position so that way it can tolerate being compressed. For the first couple of exercises, we're actually going to use a chair. We're just not going to sit in it. And so generally when we start proximal hamstring tendinopathy rehab, we start with the hip in neutral because we're trying to minimize those compressive loads that we're placing on the tendon between that ischial tuberosity and the tendon. But when we look at sitting, we actually need to be able to tolerate those compressive loads, specifically with the hip flexed. And so these next couple of exercises, we're actually going to work and gradually expose ourselves to that hip flexion under load so that we can better tolerate sitting. And so for the first exercise, it's going to be a modification of the long lever bridge, which is generally where we start proximal hamstring tendinopathy rehab. And so what we'll do is we're going to lay on our back and we're going to put our heels on the chair. And so the long lever bridge is generally held in a position like this. You'll notice that my hips here are in neutral. And so what we can actually do to modify it is actually drop our hips down a little bit, but still keep our glutes off of the ground. And then just hold this position here. And I'm going to push my heels down into the chair to get a little bit more hamstring activation here. And then we can hold this position for 30 to 45 seconds. And then once we can tolerate that, if we actually want to make it a little bit harder, we can go to a single leg. So we can actually hold this position here and then just lift one leg up. So I'm focusing just on this left leg. It's quite a bit harder, but we're increasing that load on that tendon in a flexed position. And so once we're able to do that, we can actually scoot a little bit closer to the chair. So we're adding more hip flexion into this exercise. Lift our hips off of the ground, hold this position here. So now we're loading it under more hip flexion. And then again, 30 to 45 seconds. And then if we want to make this a little bit more challenging, we go up and then hold that single leg, pushing that heel down into the ground to get more hamstring activation in this position. Again, holding for 30 to 45 seconds here. Another exercise that we can do in this position is an eccentric long lever bridge. And so it looks very similar, just we're not going to actually hold the position that we did for the isometric hold. We're going to slowly lower ourselves down towards the ground. So what it'll look like is we'll go up into that long lever bridge, and then we're just going to slowly lower ourselves down over 3 to 4 seconds, and then come back up. And so again, to increase the amount of hip flexion and compressive load on the tendon, we could scoot a little bit closer to the chair again, bridge up, and then slowly lower ourselves down again. Another exercise that we can do is a straight leg extension, and we can either do this against a wall or in a door frame. And so what we'll do is we'll take the leg that we want to work on, and so in this case it's going to be my right leg. I'm going to place my heel up against the wall here. And what I'm going to do is I'm going to push my heel down into the wall, and that will help activate that hamstring under some hip flexion. And so the way we'll progress this exercise is scoot closer to the wall so that our leg gets up higher to 90 degrees or so. And so the goal would be to try to get around 90 degrees and then push against the wall, because that will be in about the position that if I just bent my knee, I would be in a sitting position. So this is a little bit easier than some of the chair exercises because you can control the load a little bit.
So if you have a really irritated tendon, this might be a better place to start than with some of those chair exercises.
And then the final loading progression can be something like a hip airplane or a deadlift. And so we'll actually just be in a standing position. And so for this exercise, I'm going to be focusing on my left leg. So I'm going to stand on my left leg here. And what I'll do is I'm going to try to keep my spine in neutral and just bend through my hip. So we're going to load that hip into more hip flexion. And so what we'll do is we'll bend down just like so, and then come back up. And so again, the goal is just to move through this hip here. And so we'll go down and then come back up. If you need to, you can always hold on to a wall or something like that if balance is a concern, because we're just trying to load that hip into flexion. Obviously, we want to have good balance, but if we need to, hold on to a wall or a chair or something like that. And then just bend over again, hip flexion, and come back up. And so one thing to take note of is that when we're actually in this position, we're trying to keep our hips level here, and we're trying to watch for any rotation. So if we can, we're trying to keep our hips level here and just pivot through that hip just like so and try to minimize any rotation. Additionally, if we want to add some more load, we can just do with like a barbell or a weight, something like that, to just add a little bit more load to the exercise so that way we're increasing the compressive load. So that way when we go to sit, we've built up enough tolerance in that tendon to the compressive loading. And one thing to note, while the compressive loads of sitting can definitely irritate that proximal hamstring tendon, it can also irritate sciatica as well. And so one quick screen that we can do to see if it's maybe more proximal hamstring tendon pain or sciatica is actually changing our torso position. And so if we slouch and we get a little bit more pain right at that ischial tuberosity, we might be thinking that it's more sciatic nerve involvement because we're actually putting a little bit more tension on that sciatic nerve while we're not really changing much of the compressive loads on the hamstring tendon. And especially if we start to get some numbness and tingling down the leg, that's definitely more indicative of sciatic nerve involvement than it is proximal hamstring tendon pain. Alternatively, if we actually extend our torso and so sit up in that more upright position and we have a decrease in some of the pain, then in this position we've actually provided a little bit of slack for that sciatic nerve. So if the pain decreases, we're thinking it's probably more proximal hamstring tendon than sciatica, although we definitely need to do a little bit more assessment to see if it's sciatic nerve involvement or proximal hamstring tendon. But this is just kind of a quick screen to kind of see which one might be more so the cause of that pain with sitting. Thank you for watching this video on proximal hamstring tendinopathy and pain with sitting. I hope that you found this information useful. If you did, go ahead and give this video a big thumbs up. It helps with the YouTube algorithm and lets more people see this video and help them out. If you want to see more videos on proximal hamstring tendinopathy, I'll link a couple of them over here. If you want to subscribe to the channel, which will be great help to me, I'll put the button over here. Want to be notified of future videos? Hit the bell icon down below. I'll see you guys in the next video.